Good evening. Welcome to the Recovering Perfectionist Mama Grace in Progress podcast. I am Buffy. For those of you that are just joining us, welcome. Happy to have you. For those that are returning, also happy to have you. I hope that we are finding topics that interest you and are in the women's lifestyle space that you find compelling and may actually have learned something from, hopefully. I like to learn information. I like to share information. And my ultimate goal is to level up and help others level up if that's something that they want, and ultimately show our kids that living a good life is possible and that we inspire them, and that potentially be part of our legacy, showing our children that having a good life is possible so they inspire others. Additionally, I would like to potentially cultivate a village of women who are looking to level up and continue leveling up. That would be really awesome. So without further ado, let's talk about the hidden signs, understanding female-specific health conditions every woman should know. Did you know that the number one killer of women isn't breast cancer, it's heart disease? And that thyroid disorders affect women up to 8 times more than men. I myself have hypothyroidism. Came out of nowhere, unfortunately, but it's also genetic. And I have that in my family line, unfortunately. Today, we're breaking the silence on specific female health conditions and the warning signs that too many women miss. So let's again go back to the idea that this is the place where we talk about all things women's health, wellness, and empowerment. I'm Buffy, and today we're diving into some of the most misunderstood and underdiagnosed conditions that affect women differently than men, and sometimes more seriously. We're talking about heart disease in women and why the symptoms often don't look like you think. Osteoporosis, the silent condition that can sneak up midlife and beyond. Thyroid health, from Hashimoto's to hypothyroidism, and what your fatigue may really mean. And a few other key conditions like autoimmune disorders and PCOS that deserve more attention. This episode isn't meant to scare you. It's meant to empower you with knowledge, tools, and early warning signs so you can advocate for your body with confidence. So grab your coffee or throw on your sneakers and let's dive in. Part 1, heart disease in women. Let's start with the big one, heart disease, the number one cause of death for women worldwide. Here's the problem. Women's symptoms often look different than men's, so they get missed, dismissed, or misdiagnosed. Typical male heart attack signs, crushing chest pain, arm pain, collapsing. Common female warning signs, shortness of breath, nausea or vomiting, unusual fatigue, sometimes days before the event. Pain in the jaw, neck, or back. Pressure or discomfort in the chest, not necessarily sharp pain. Because women's arteries tend to be smaller, they're more prone to microvascular disease, which doesn't always show up on standard tests. Actionable tips for heart health. Know your numbers. Track your blood pressure, cholesterol, blood sugar, and waist circumference. Prioritize anti-inflammatory foods. Think colorful fruits, leafy greens, salmon, flax seeds, and olive oil. Move daily, 30 minutes of moderate movement most days, walking, dancing, resistance training. Manage stress. Chronic cortisol spikes raise blood pressure and inflammation. Don't ignore fatigue, especially if it's paired with breathlessness or dizziness. Pro tip, advocate for gender-specific cardiac testing if symptoms persist. Women often need more nuanced screenings, like coronary calcium scoring or stress echocardiograms. Let's talk about part 2, osteoporosis. Osteoporosis is often called the silent disease because you don't feel your bones weakening until you break one. Women are at greater risk because of hormonal shifts, especially the drop in estrogen after menopause, which accelerates bone loss. Warning signs to watch: shrinking height, stooped posture, sudden back pain, could be small fractures, family history of fractures or osteoporosis. Here's some actionable strategies. Calcium plus vitamin D. Your bones need both. Calcium builds, vitamin D absorbs. Calcium sources: leafy greens, almonds, yogurt, sardines. Vitamin D, sunshine, salmon, or supplements. Strength training. Resistance exercise literally tell your bones, hey, stay strong. Limit caffeine and alcohol. Both leach calcium from bones. Avoid smoking. It accelerates bone breakdown. Get a DEXA scan, especially post-menopause or if you're over 50. Bonus tip, include magnesium and vitamin K2 for bone mineralization. It's not just about calcium, it's about balance. Next, let's talk about thyroid health. Now, let's talk about a major health issue that often hides in plain sight, thyroid dysfunction. Your thyroid regulates energy, metabolism, body temperature, and even your mood. And guess what? 1 in 8 women will develop a thyroid disorder in her lifetime. Common symptoms of hypothyroidism or underactive thyroid, which is what I currently have. Fatigue or sluggishness, hair thinning, weight gain or bloating, feeling cold, irregular menstrual cycles, depression or brain fog. Common symptoms of hyperthyroidism, which is overactive thyroid, anxiety or irritability, racing heart, unexplained weight loss, sweating or heat intolerance, tremors. Actionable strategies: test, don't guess. The other thing you may run into is what I'd actually ran into is my thyroid numbers seemed normal for the old guidelines. But when we started looking into it, all the symptoms matched. And I finally, when I'd gone to a fertility doctor, was told that, hey, you do have a problem. It really needs to be under 2. So that was their personal recommendation. And it ultimately got me on synthetic levothyroxine. And then I started seeking help from Forefront Health, which does thyroid and stuff. And I've actually have almost normal numbers. I'll have to recheck here soon. And hopefully I continue to be normal. Test, don't guess. Ask for a full thyroid panel. TSH, free T3, free T4, reverse T3, and thyroid antibodies, TPO and TG. Support your thyroid through nutrition: selenium, Brazil nuts and eggs, zinc, pumpkin seeds and oysters, iodine, sea vegetables, iodized salt in moderation. Reduce environmental toxins: BPA, phthalates, and flame retardants disrupt thyroid signaling. Manage stress: cortisol affects thyroid hormone conversion. Don't ignore your symptoms. Many women are told it's just stress, but your thyroid might be waving a flag. Other female-specific conditions. Let's touch on a few others worth mentioning briefly. PCOS, polycystic ovarian syndrome, impacts 1 in 10 women of reproductive age, linked to insulin resistance and hormonal imbalance. Strategy: focus on blood sugar balance, movement, and anti-inflammatory nutrition. Autoimmune conditions. Women are 75% more likely to develop autoimmune disorders. Strategy: reduce inflammation, support gut health, and manage stress. Perimenopause can bring sleep changes, anxiety, and heart palpitations that mimic other illnesses. Strategy: track your cycle, communicate with your provider, and consider natural supports like magnesium, adaptogens, and mindful rest. Conclusion: here's the bottom line. Women's health isn't one size fits all, and our bodies often speak in whispers before they shout. So listen to your fatigue, your stress, your mood swings, not with fear, but with curiosity. Your body's not broken, it's communicating. When you combine awareness, preventative care, and daily habits, you can catch issues early and take charge of your own longevity and quality of life. Because the truth is, you're your best health advocate. If this episode hit home, share it with a friend, sister, or coworker. Subscribe, leave a review, and tag me on social with your biggest aha moment. recovering_perfectionist_mama. Let's rewrite women's health, one informed conversation at a time. Heart disease, thyroid issues, bone loss, they're not just older women's problems. They're women's health realities happening every day, often undiagnosed or dismissed. In this week's episode, we decoded the warning signs, prevention strategies, and real talk on how women's bodies respond differently, from hormones to heart health. If you want to understand your body better, this one's a must listen. Thank you for tuning in, and I hope you have a great day. Bye-bye.